Hello everyone. Today is July 10th, 2024, and this presentation is for my class at Georgia State University, Teacher Residency. Today I will be showing each of you how to measure the radial pulse. To start, your materials that you'll need is a secondhand watch, gloves, and I'm pointing to the back because I am in the classroom setting, gloves, and hand sanitizer. And you will see here in the bed is Jane. So, by the time that we finish, you will be able to check for the radial pulse. First off, checking for the radial pulse is important because two reasons. We are checking for a heart rate and healthcare settings. But more importantly, we're checking for a heart rate because without a heartbeat, the person is dead. Now, scenarios would be pulled up to a scene, seen someone lying down, unconscious on the ground. First thing you would need to do is check for a pulse. There are different places that you can check for a pulse, but today I will only be teaching the radial pulse, which is found on the wrist. Some people check for the radial pulses now with stethoscopes, but I will be doing it the fundamental way because you may pull up to a scene and not have a stethoscope. Only things you'll need today, again, will be a two-hand watch, hand sanitizer, and gloves. And definitely your two fingers. So let's get started. The first thing that we look for is the radial pulse on the wrist. But you take your two fingers, and I want to emphasize that you take your two middle fingers only. Now, one may ask the question, why not use your thumb? Well, we don't use our thumb to take pulses simply because the thumb has a pulse of its own. So we always use these two fingers. I don't care which hand you use, if you're right-handed or if you're left-handed. I'm right-handed, so more than likely I will always use the two fingers on my right hand. So we take these two fingers and we reach over that artery and we feel for a pulse. I also want to say, as I'm illustrating, that there are times when you're reaching for the pulse and you may not feel it right off. If the person is a little meatier, a little more fat, a little more adipose tissue, as we would call it, or it's an obese person, sometimes when you're feeling for the pulse, you have to reach a little further down. You have to push in a little deeper. Now, I will, because most of the time when you're checking for the pulse, the watch is not in the way. So I'm going to remove my watch so that you can see what I'm doing here on my arm. So here I am. There is that radial artery that we look for. Take those two fingers, reach over that artery. You should feel for that pulse. Now, of course, I feel mine right away because I know what to feel for. But if I were doing it on a patient and she's in bed, same thing I would do, but I would be doing it anatomically for her. I would reach over and feel for her pulse. Remember, we need to keep this thumb out of the way. Why? Because the thumb has a pulse of its own. So I would reach over here, over that radial artery, and feel for the radial pulse. Now, let's stop for a moment. 3 types of people that we deal with in the medical field: babies, adults, and geriatric adults. All 3 run different pulse ranges. Now, the pulse range that you will be looking for should be on an average between 60 and 80. Every now and again, you may run 62, 64, 84, 88. When we begin to go lower, we're dealing with something that's moving slow, hypo. And then if the pulse is higher, we're dealing with hyper. And that's how we get into hypertension and hypertension. We won't get into that today. But also, with that being said, when we're dealing with the pulse, there are different places that you can take pulses. There are different pulse points. Carotid artery, you can take it in the pedal, which is your feet and the knee. So, but we're only going to be teaching the radial pulse and how we look for the radial pulse. So, right now, I want you to take your two fingers, for your left hand and right hand. I'm right hand. Take your two fingers on your right hand. You have someone that you can do it with. That's fine if you can partner off. If not, that's also fine. But you can take your two fingers, hold up your wrist, place your two fingers over that artery, and feel for your pulse. Now, with new students, we can take a pulse in 15 seconds. We can take a pulse in 30 seconds. We can take a pulse in 60 seconds. New students, I like for them to do 60 seconds. Because if you do it in 15 seconds, you have to multiply the number times 4. If you do it in 30 seconds, you have to multiply the number times 2. But if you're only doing it for 60 seconds, if you do it for that whole minute, you should have an accurate number. That number needs to be accurate, as close to accuracy as it can be. Now I will come around and check and work with you all when you're doing it. Let's do it for the purpose of taping. I'm going to do it for 15 seconds, okay? And you can watch that clock. We're going to do it when the clock is on the 9, when the clock is on the 12, when the clock is on the 3, or when the clock is on the 6. It doesn't matter as long as you're doing it in increments of 15. With that being said, let's get started. So, when that clock reaches 9, and you can't see it, but I will let you know, you start when your clock on your second hand reaches 9, 12, 3, or 6. All right, here we go. 10, 9, 8, and I'm only counting down. 6, 5, 4, 3, 2, 1. Let's get started. Okay, so I did mine for 15 seconds. So my heart rate, 15 times the number that I got, right? So I counted it for 15 seconds, right? So my heart rate was beating at 72. Now, if I come around and we're checking the same person for the same amount of time, you can do it for 60 seconds, and I can still do it for 15 seconds. We still should come up with the same number because it's the same person, same pulse rate. I should not come around and feel a patient's pulse. I'm feeling here anatomically on the right side, on the left side, and you're on the right side. And I feel a pulse of 80, and you feel a pulse of 64. I don't care if you did it for 60 seconds or 15 seconds or even 30 seconds. We still should come up with the same number. It's not different, and it's not. If I had 80 and you said 81, that's fine. If I had 81 and you said 82, that's fine. But we shouldn't be off. We deal with the pulse as in taking blood pressures. The way that we take the blood pressure is because we're taking the brachial pulse. That is another pulse point. But it is imperative that you have that pulse accuracy. That number should be correct. Okay? Now, I'm not going to get into detail about obesity, people. I'm not going to get into detail about weight at all. That's not essential at this point. But know that if a person is resting, their pulse should not be 100, 110. They're not doing anything. But if the person has been running around, running track, exercising, moving about, it will be a little elevated. Now that is a true statement. It may average 80, 82 on a resting, but if the patient has been moving about, even if the patient is running into the office because they are late, the pulse rate may average, if you're looking through notes, at 80. But if you're in a hurry and you're moving about, your heart is working, it may be a little elevated. So sometimes it's okay to take a pulse and a blood pressure after the person has settled down. I want you to do it one more time, and I'm going to do it with you. What two fingers are we going to use? We're going to use our middle two fingers, and we're going to check over that artery here and check for that pulse rate. How long? 60 seconds. Now, as a conclusion, I would like for you to go home, work on someone at your house, mom, dad, even your kid. But make sure that you know now children run a little different, especially babies. So it would probably be best to deal with adults because you're novelists at that. So it'd probably be best to deal with adults. When checking a radial pulse, we will be checking it for 60 seconds. You do need a second-hand watch or clock when you're checking it. Remember, sanitize your hands and use your gloves at all times in the medical field and anywhere else post-COVID when you're touching people for your safety and for theirs. You want to make sure that when you're home and you're doing this, that you take all of what I said into consideration, although it's family members. Thank you so much for being kind enough to watch, listen, take pulses at home to get your skills good. Thank you. Again, this is Shannon Hendricks with the Teacher's Residency Program, and goodbye.